According to the Philippine Cancer Society, approximately 14,000 Filipinas a year are diagnosed to have breast cancer, and that makes the Philippines a country that has the highest rate of breast cancer cases in Southeast Asia.
While this rate is very alarming, early diagnosis and intervention have made the disease more manageable.
But if the breast cancer is already at an advanced stage and the patient has to undergo a mastectomy, breast reconstruction can bring about a renewed lease on life by making a woman feel whole again.
Today, we'll give you more information about this life-changing procedure and the reconstruction options that are available to women. Send your questions our way, because the more you ask and talk, the better we, doctors, can help you. Your health depends on you and me. I'm Dr. JJ Chongson, pitching in for Dr. Oye Balburias.
And I'm Maricel Laksa Pangilinan, and it's time to
Talk to Doc.
Well, before we talk about breast reconstruction, let's tackle the idea of breast cancer first. Ano ba talaga yung breast cancer?
Well, cancer in general is abnormal and uncontrolled growth of cells in the body. So, breast cancer is the abnormal growth and uncontrolled growth of breast cells. This especially occurs in women.
Okay, so what are the symptoms that should alert the women to the possibility that breast cancer might happen? Yeah.
Well, there are a lot of signs and symptoms of breast cancer. If you see some changes in the skin over the breast, or if there's pain, or if there's some lymph nodes, especially near the axillary area, o yung mga tinatawag natin in a local language, kulani. No? All of these are symptoms. Sometimes there are breast discharges. Aside from milk, there could be breast discharges, and this can be also a sign of breast cancer.
Yeah, importante talaga yung magpapa-test sila, no?
Correct.
How is staging in breast cancer done?
Well, we stage breast cancer using 3 means. We measure the size. First, the size, and then lymph node involvement, or yung kulani, kung may kulani, especially in the axillary area o sa kilikili. And the third one is organ metastasis, if it has encroached into other organs. This is how we stage it. And it's important to know, Maricel, the risk factors for breast cancer. So,
ano yun?
Ang mga risk factors, if you have a very strong family history. So, if your lola and your mom had breast cancer, there's a high chance that you will have breast cancer too. If you have early menarche or your first menstruation, or you have a late menopause, if you have pregnancy later on in life, beyond 30 years old, and heavy smoking, heavy alcoholic beverage drinking, obesity, all of these are risk factors for breast cancer.
Nako, yung mga maiiwasan natin, iwasan na natin.
Correct. Maraming maiiwasan doon.
Yes. Our featured patient today had stage 2B cancer. Let's find out from her why breast reconstruction was part of her strategy to win over the big C. Let's watch this.
It was during her 46th birthday when Meg T found out that she has stage 2B breast cancer.
I saw the breast doctor, Dr. MGB Remicol, who checked me since I complained of a lump on my left breast. And she immediately ordered a mammogram and breast ultrasound, which I had done the following day. In a few days, we got the result. Suspicious. So the same doctor, Dr. Remicol, ordered a ultrasound guided biopsy, which he performed on June 9. Days later, we got the result, breast cancer. And so we scheduled surgery.
Meg was apprehensive of living with just one breast, so her attending doctor, Dr. Catherine Asedillo, offered breast reconstruction on her left breast.
She said that the Dr. Remical was going to remove the bad breast, which means there'll be skin left. And in the same surgery, Dr. Asedillo is going to fill it up with flesh from my middle. But no nipple. No nipple right away. The nipple will have to wait until after chemotherapy.
Meg underwent a skin-sparing mastectomy with axillary dissection to remove her left breast, then an immediate breast reconstruction via transverse rectus abdominis myocutaneous flap. After 2 days of recovery, Meg was once again back on track.
The doctors were amazed. I recovered like Supergirl because I've been exercising. I exercise regularly. People who don't exercise have a lot to discover about healing.
To relieve her from cancer, she underwent chemotherapy for 6 months. Then, last March, Meg came back to complete her breast reconstruction by undergoing nipple areola reconstruction.
Breast cancer is not all that scary if discovered soon and reported to the doctor. And breast reconstruction is groovy. It's not scary at all. Surgery doesn't have to be scary. I wasn't scared at all. I was all excited to get well, which is why I recovered fast and so nicely because I had a mental attitude to heal.
Stay tuned.
Talk to Doc will be right back.